Great welcome. Thank you. Well, I'm really excited to be here with Bernard Tyson of Kaiser Permanente. I feel like I have to start every presentation, and especially this one, that Kaiser Health News, where I'm now editor-in-chief after leaving the New York Times, is not related to Kaiser Permanente, just so everyone knows. This is, don't muddy the waters here. No, we are an independent news organization, and we do a lot of health policy coverage. And I'm thrilled to be here talking about what technology can do for healthcare, because my basic assumption is that it can do a lot, but it can also not really add much to healthcare. So I'm always looking, as I was at the Times and at Kaiser Health News and in my book, at where is that intersection where technology both is profitable, because I know that's what everyone here is interested in, but also is good for healthcare. And I think sometimes those things intersect and sometimes they don't. Sometimes things that are really profitable don't really add much to healthcare. And sometimes things that should add a lot to healthcare, and I point to electronic medical records, don't live up to their promise. So I want to talk today, and I hope we'll all share ideas and you hear from Mr. Tyson about some of the ways that his organization, which is known for doing a lot with technology, has found it useful. So anyway, I'm always looking for that intersection of where is this a good business and where is it good for the patients, because that's my bottom line with all of my journalism writing. I want to just take a quick stab at the audience here to begin with. Like, how many of you are happy with the way the U.S. healthcare system works today? Do I say, is it the lights, or is it that nobody is raising their hand? Okay, so there's a lot that can be done. We can start with that. So to kick things off,
I thought you were going to ask how many of you are Kaiser Permanente members.
Yeah, you want to say that too? We're not going to ask that question. Anyway, so I think we should start off. Tell us a little bit about, I would love to hear a couple of ways that you've adopted technology that you think have been really, really good for patient care. And then maybe a couple of things that you've tried that maybe didn't add up to the kind of their promise.
First of all, it's really great to be here, and I always like talking about this because there are so many assumptions about the use of technology in healthcare, and I think that that's just a great starting point for both dealing with the myths as well as the realities.
Right.
And I would say, case in point, the electronic health record has been wonderful for Kaiser Permanente. Now, it has been challenging from the standpoint of, and this is a big issue in healthcare, as we are beginning to put more on the technological platform, in some cases, the regulations have not matched the realities of massive investments that we're making that is helping to make healthcare more safe, but we still have regulations that's based on a paper-driven industry. So that's a major disconnect. Because of our health records, and it's not just the health records, we have guidelines and all kinds of recommended procedures inside of that box, where I can show you where the quality of care provided to our members across the country has not only have we significantly lessened the gap, which means the variations of outcomes, we've also lifted the gap universally. That backbone helped to provide that kind of information and data that has allowed us to do it. Then, and I call that behind the curtain, right? So that's what the providers and great physicians and nurses and others are doing. The front of the curtain is it's added now convenience to our members. So our members can go online and look into their medical records. They can get their lab results. They can speak to the doctor and have the records available. And so the idea that a medical record is just a data repository or somewhere where you deposit the data then I would say that's probably not an efficient system versus being a backbone of a whole healthcare system.
And that's part of what I want to talk about, because I think so much is about the intention. Why did you create this system? I hear from other health systems where a physician will say, wow, we could use this to track infection rates and publish them. And the CEO is like, well, don't do that. We don't want to know about that. So, and also, I always love the example of, two Harvard hospitals. If I get my x-ray at one of them, I have to literally pick up a disc and walk across the street to the other because their EMRs don't talk to each other. So how can we, so you have a kind of complete organization where it's your incentive to have everyone talking to everyone else and your patients to have their data. What about people who are in the fee-for-service world, who are not living in their own universe?
But I guess the question that I think is underneath that is, what should the American people expect of the healthcare industry? I think the American people should be outraged if they are using or going in to see a doctor or a healthcare system in the 21st century and it's still driven off of paper. We know the inefficiencies of that. We know the challenges of that. And yes, it is a difficult task to convert, but the benefits that you can get in the short and long term, I think, far outweighs the expense of doing it. At the same time, it will disrupt the organization. And so I do not want to pretend that it's been a walk in the park. The lives of the physicians inside of Kaiser Permanente has changed dramatically with the capabilities that we've built with technology. The ability of members to do virtual visits, which is a big win for our members in Kaiser Permanente. But it has also come with major challenges for our physicians and others in how to keep up with the demand.
Well, I want to ask two things, because some of the things that intuitively I think an electronic medical record system or an e-prescribing system should be able to do, they can't do. I mean, when I came out here, I went on, TripAdvisor and looked at airfares, and I knew which was cheaper. If I have a pharmacy, if I have a prescription, an e-prescription, I have no way, my doctor has no way to know which pharmacy it will be cheaper at. And plus, why do we put all this burden on consumers? I mean, I just got a note from a patient who, fills one script at Sam's Club and one at Target and another at her local pharmacy. And that changes every month because she has to do research every month. Why hasn't the EMR delivered that kind of information, which it does in every other industry?
Well, home run. Bam.
Go for it.
You're clearly not talking about Kaiser Permanente.
No, right. No, I'm not. And I'm asking you to answer.
You go online right now, you can order your prescription. You can decide if you want to pick it up or have it delivered. In fact, and not too long from now, we're going to have on-demand delivery. We now have systems in place where we can do mail delivery. We're now working on 24 to 48 hours to get it to you. You're absolutely right. When you get the receipt, you'll see how much it costs. You'll see what the savings are. All of those expectations should be met. And I think it's a matter of time before you see this everywhere. There's just no question about it. I think that the whole pricing of the industry should be transparent. And we're working on that, by the way. Mm-hmm. And it's a lot of work to do it because the industry have not been set up like other industries. And so the issues of subsidization across business lines and all that stuff that is in there has to be really cleaned up so you can give the consumer a bill that is an accurate reflection of the actual price.
And what about you mentioned allowing people to do virtual visits. That to me is like, again, it's kind of there's benefit and there's also risk. I mean, I sometimes hear I hear from everyone who's not happy with their health care in America. And so that's like, a whole lot of people, who are put in hospice care and they get an iPad. And it's like, okay, don't worry, we're giving your mom an iPad and she'll be fine. What mom wants is someone to come and talk to her, hold her hand, check on things. So how do we make sure as we're moving into this world of virtual medicine and telemedicine that we use it where it's appropriate? It's obviously cheap to give everyone an iPad instead of an hospice nurse, but it's really not what hospice is about. So how do you draw the line of what's appropriate for telemedicine?
Yeah, I mean, in Kaiser Permanente, we're very clear is high tech, high touch.
Yeah.
We're very clear about that. We use those terms, high tech, high touch. Healthcare is still a touch business, right? It's a human interaction. There are times where technology is very appropriate for efficiency, for simplicity, for convenience, and all of that should be calculated against, does it benefit the consumer directly? Yeah. There's other times where you need to augment or complement the human touch with technology. And then there are times in which the technology is very inappropriate. I can't imagine as a practice that you would give all patients with hospice a computer. And those patients are dealing with end-of-life care, right? So I don't know, if that's a one-off example, but I don't think it is representative of the healthcare industry.
Well, I think it's, there's a lot of ideas bubbling, and I wanted to talk about, because everyone's hearing about, the new Apple Watch or the new wearable monitoring systems. I have a 94-year-old mom, and when people say, oh, it's great, she can have an Apple Watch, and if she falls, she can and I've tried to give her an iPad to explain it to her. And she's a pretty active 94-year-old. It will not help her to have so how do we, and it sounds cool. For a lot of young people, it seems obvious that this would be a great thing to my kids monitoring all the time. Where's monitoring useful, and where is it, where is it not so useful? I mean, where do you use monitoring, the remote monitoring capability? And where does it worry you that it's kind of become, everyone wants to know their numbers all the time?
I guess I would want to back up for a couple of things. One, I think it depends on what kind of framework we're talking about, yeah. Right? So I want to be clear. My framework is we're doing everything we know in our power and capabilities to maximize healthy life years. So the Kaiser Permanente system is really built on how do we prevent and how do we partner with people so they can take charge of their health.
Right.
It is not designed with the philosophy of let's wait until you get sick and then we'll put all these resources on you. When you get sick, we can show you the data of how well our wonderful physicians take care of you. But the model, the system, is to work with people to keep them healthy.
Right.
So from that standpoint, technology is a godsend in a lot of ways. Because just like any other industry, it helps people to be better informed, more intelligent about how to deal with something that's more important, in my view, than your car, than taking a trip, than some of the things that we are attached to technology to make life simpler for me.
Can you give me a concrete example, like what technology do you feel has helped your community, your patient community, keep track of its needs?
The iPhone, the ability of a Kaiser Permanente member to go on an app and go to their Bank of America account and transfer money and then go on their app and ring into Kaiser Permanente and say, I need to have a virtual visit to check out this cough to make sure it isn't serious and to see if I need to come in and be seen, right? There's a benefit right there.
Yep.
It's so convenient that the person isn't saying, wow, maybe I need to wait to see if this is pneumonia, and then end up in the emergency department, and what could have been taken care of through an e-visit or come in for a doctor office visit, which may be, for the sake of this, $100, versus the person going on because, man, it's really inconvenient to drive across town. Maybe I'll try this out, home remedy. And next thing you know, they're in the emergency department with the pneumonia. And that's $5,000. So that convenience is right there. The point that I'm making is, I don't think it's technology for the sake of technology. That's not what we're trying to do at Kaiser Permanente. We're trying to figure out, number one, what tools are out there already that we should be using. So case in point, 24 hours before you take off on an airplane, and I take off on an airplane, I can pre-check, right? We asked one day in Kaiser Permanente, why don't we offer that to our members? Let's have pre-check, where people can get notified within 24 hours that you have an appointment tomorrow at 3 o'clock. You have a $25 fee. Do you want to pay it now? Pay it online. We also have now kiosks when you come into our medical office buildings. Do you want to go to the computer, to the system to check in, or do you want to work with somebody at the desk? So it's allowing different choices and options to be made. The last thing I would say, in terms of the Apple Watch.
I noticed you don't have one on.
Right, yeah, no. I'm not opposed to it, though.
Yeah, no, I'm not either.
But the Apple Watch and other tools that even we are looking at, it's all about what information should a person have about their body,
Right.
right? I mean, you get in a car, you know basically what the tire pressure is, you know about the RPMs, you know about the speed, you know how much gas you have, blah, 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 right? Think about that for the human body. How much should we know about our bodies? And I think these are signs that people are interested in learning more about their bodies.
Yeah. Now, I'm going to push back a little bit, because what you're talking about in terms of the flow of patients clearly removes a lot of the barriers that exist in the fee-for-service world and sitting around. I'm asking now, because I think there's a lot more development in this area about the remote monitoring possibilities, which I think are a little more complicated, because when you say tire pressure in a car, well, I know what the tire pressure should be in a car. I also know, as a former physician, that people's blood pressure goes up and down all day long. And when I worked in a hospital, we were frequently turning off those monitors because it makes people nuts every time they get excited.
Yeah.
So how do we kind of give people data, a thirst for knowledge, without making them nuts about things that really don't matter?
Yeah, I think that's part of the challenge that we have to solve in the industry. And the question is going to be, in the future, who's going to build those kind of platforms to determine when the data is real information that needs to be used versus it's noise that's helpful, but quite frankly, not really needed in terms of moving the field forward. By the way, I would separate that, though, from in some cases, we do remote monitoring now of our members so they can go out and live their lives, but we still have a sense of what's going on with them. Congested heart failure patients, asthma patients, some of our patients with chronic diseases, we're now using monitoring tools that allows them to go and live their lives.
Can you give me an example of how you monitor, what kind of tools you use for asthma, for example? Or
we can now, if you're an asthma patient, we now have the kind of technology that we know what's going on in the atmosphere around you. So we can warn some of our asthma patients to make sure that they're paying attention to breathing and all those things, because they're about to go into a day in which the pollen count is up or whatever the other things that's going on. We have monitoring tools for our cardiac patients, and so we can monitor your weight with you, and we have capabilities of doing that. We have work that we're doing with different now chronic diseases that our physicians and others are sampling. And the whole idea is obviously to take advantage of, we're now in the fourth industrial revolution, to use the term, and some of the sensors that you can apply to human beings allow us to do things that are more efficient, to have a nurse who can be in a call center and watch over a group of patients and call you, for example, if something is going on.
Yeah.
That's where you have the relationship versus you're out there by yourself with a bunch of gadgets and you don't know what to really pay attention to.
And I'm going to ask relative to that, because I think that combination of tech and touch. Last time I was at Rock Health, and it was probably 4 or 5 years ago, I sat in on a panel that somewhat alarmed me, so I'm going to ask the question again. Someone said, how many of you would prefer a robot to a doctor? And a lot of people put up their hands feeling like, or a nurse, that would be a better thing because it's, it's more algorithm driven. Would any of you prefer to have a robot or a physician? I don't see a lot of hands. Last time, yeah. And I guess, are we ever going to be in a completely algorithm? I mean, when I hear that, it gets me a little alarmed, because I think of some of the patients I saw when I was an ER doctor where they had symptoms of chest pain, but their EKG initially looked okay. So if you're counting on someone to just send you an EKG without that human interaction, I worry. So how far can we move? But that doesn't mean that there isn't a lot we can do that way. There's a lot where we require people to go to a doctor's office for an interaction that basically is just a hassle. So where do you see as the next frontier for monitoring outside of the hospital or the doctor's office? I mean,
I don't think it's extremes on both ends. So I think it's fair to say that a physician in the 21st century, based on what I'm reading a lot about and talking to physicians within Kaiser Permanente and across the country, trying to keep up with all the changes that's going on and the knowledge that's being created in the industry, as wonderful as the brain is, it cannot keep up with everything. Mm-hmm. Totally dependent on the other extreme, totally dependent on robotics and artificial intelligence to substitute and take the place of humans is probably not a feasible scenario as well. So the question is, how do you leverage the two? Mm-hmm. And I would tell you, in my view, it's a question of how technology will continue to complement the practice of medicine, not overtake it. Mm-hmm. That's not to say that there aren't some things that you may rely on technology to basically perform the function, but still you need to have the oversight and the guidance by the knowledge of the physician, the knowledge of the nurse being there. Now, but then I end with, there's no substitution for the human touch.
And what about areas like pathology, radiology? I assume those have been quite disrupted already. And how does it change your staffing? I mean, is it, are we in a future of no more radiologists, no more pathologists?
No, but I think it, once again, allows us to continue to be more efficient in the healthcare industry. I think that for the radiologists and others, they're practicing up to the full scope of their practice. And so you end up, as much as possible, getting rid of routine things that could be handled elsewhere or complemented with technology and really focused on what the physician is really capable and really wanting to do, and that's the high-end precision work that's helpful to the patient and to the system itself. And I think that over time, those efficiencies will make healthcare more affordable for everyone. And as we sort through the challenges of how the industry is shifting and how we need to make sure regulations continue to shift as well to keep up with the times. Regulation is very important, and it needs to keep up with the times to make sure that the best interest of the patient is always front and center.
Yeah, that's my mantra, like what's right for the patient. So what coming down, and I'm kind of melding my questions with some of the questions coming in here. What do you see coming down the pike in the way of technology that makes you most excited, that you think will be transforming to healthcare?
I think that healthcare finally is being disrupted in a way that is not based on the industry determining everything. You know, where people historically have come into the healthcare system and have been obviously so respectful of the expertise and in need of what you get from the healthcare system, that in some ways they have given over everything to the system. Now we're seeing a major shift where people are coming in more like consumers and with expectations of the healthcare system. And I think that the whole experience of what a person gets from the healthcare industry is a dynamic change that is going on, and that's driving many of us to invest in the kind of technology that creates more comprehensive experiences for our patients, for our members. I also think that as we now have more organizations that's thinking about a total health approach like Kaiser Permanente, the idea that you're now looking at social determinants of health as part of how do you help someone maintain health, how you're trying to connect resources in the community to augment the resources of the industry to create the kind of infrastructure around a person to maximize their healthy life years is very exciting.
Okay, well now I'm going to put you on the hot seat for the whole health industry, not just Kaiser Permanente, because you're the one I have here. No, I think, why is it with all this exciting technology on the horizon, why do premiums keep going up? I mean, technology in other sectors makes things more efficient and cheaper, and yet, you know, at KP as well as all over, you know, we say, well, they're not going up as much as they were a couple of years ago, but they're still going up. So why hasn't technology delivered to me the financial benefits that it's delivered in other sectors? Well, or the convenience, mostly, frankly. In your organization, there is greater convenience, but in a lot of the healthcare world, you know, my kids are like, as you said, well, why am I getting, it's the only thing I get in the mail anymore are these health bills, and they're incomprehensible.
Yeah, well, wow, you really are asking me to answer for the whole industry.
Yeah, well, you're here, and I'm a journalist, I can't help it.
No, I think that the healthcare industry is at that tipping point of the massive changes that we're talking about. That, you know, the industry has many inefficiencies in the financing of the industry itself. It's still very much siloed. Yeah. So you have different parts of the industry going after the same dollar. You have a lot of subsidizing of care because the financing of it is coming from multiple streams. And so you have what you get from the government, what you get from the commercial population, what you get from individuals. You have the suppliers of the industry in which there's no, in some cases, no control, or there are competing demands. And so the drug industry is one example of that great drugs are being created, but they are very expensive. Yeah. And the question is, how do you finance that and how do you fund that? That said, I think I'm hearing more and more of the conversations happening in the industry centered around affordability. There are organizations transforming themselves with the centerpiece being we're going to make healthcare more affordable and accessible to more people.
And how do you feel about the, we saw a lot of headlines earlier this year about the JP Morgan, Chase, Berkshire Hathaway, Amazon. Does that scare you? Or do you think to me, there's a clear signal there. We are going to try to disrupt, if only for our own employees, because we know we're not getting a very good deal. Does that scare you? Do you think, wow, here's an opportunity? Maybe this industry needs some goosing. Go ahead.
Another home run.
I'm not setting you up. I'm just, if you got the answer, that's great.
The reason I said that, I remember when they first announced it, someone asked me that question in the media, and I said, number one, I applaud them for what they're doing. Number two, I absolutely believe it's the right thing to try, and they might be the absolute right people to do it. Thirdly, Henry J. Kaiser was not in the healthcare industry. Henry J. Kaiser was building ships and dams and freeways and washing machines, and he was doing all that stuff. And then he decided there's got to be a better way to take care of my employees and my workers. And ultimately, that became what is today a almost $80 billion organization called Kaiser Permanente. So the idea that somebody outside of the industry can't come into the industry and disrupt and transform and push an agenda for the sake of millions of people, I think is absolutely possible. Kaiser Permanente is a great example of it. And his intention, along with Dr. Garfield, the physician side at the time, was literally to disrupt the healthcare industry. And that's evidenced by we are not on a fee-for-service basis like the rest of the industry. We focus on prevention as much as we focus on sick care. And it was all driven by, at the time, an industrialist who saw a better way in his vision for how to provide high-quality, affordable care.
And as we move to more technology, more capability to monitor outside of the hospital, these are business opportunities, how can we bring more healthcare, the hospital and home? It's kind of the new mantra of like hospital at home. And we've seen a lot of infusions move to the home. And yet I go to cities around the US and I see hospitals building all over the place. And I'm like, gee, I hope you're going to have a plan to convert those to condos, because if all this technology works, I don't know how you're going to keep those beds filled. How is KP thinking about hospital care in the future?
Oh, there's going to be a lot of hospital care at home. We are evolving in that direction also. We have, for example, there's so much you can do outside of a hospital that used to be traditionally done in a hospital. We have our super hubs, as we call them, in different parts of the country now, where somebody could come in up to 23 hours, and we do care in those settings, and they're high-tech centers that used to be done in a hospital setting. You look at the sensor technology and how many of our patients in the industry are in hospital beds for observations. You're going to be able to move those kinds of patients into a home setting. I think the hospitals of the future are going to be these high-tech centers in which there's concentrated care that's going on. I also think they're going to be more of a utility for the community and for the area, as opposed to it's just landlocked for one particular organization or something like that. Mm-hmm. And they're going to continue to be very expensive because of the tools and the capabilities that you will find in a hospital setting. I also think it's the right thing to do. I mean, the hospital is and was the gravity of healthcare. It was centered around the hospital, and then everything else was built around it. Now with technology, you can have care anywhere if it's done appropriately and with the right guidance.
And what, I'm seeing a bunch of questions from the audience that are about this. So what do partnerships look like with something like KP? how can people who have an idea, a startup, a disruptive technology, find their way into the healthcare system? Because often what I hear when people have startup ideas, and I'll just give you one example, people who want to do generic joint implants, they will look at the now 3 big joint manufacturers, maybe 4, and they call them the cartel. You know, it's hard to disrupt some of these business relationships. How do you do that? How can people partner with you?
We have a KP Venture Fund. So we actually fund some of the startup businesses that we have an interest in terms of potentially what they could do for Kaiser Permanente. We also, in some cases, we do some of the research with startup companies to look at the applications into a Kaiser Permanente type of environment. We get a lot of requests to do that, and I would encourage people to really think about how innovation continues to disrupt the healthcare industry. One of the things I would say in the final statement, though, is that for me, is innovation and being able to scale. And so it's not innovation just for innovation and just to be in a pocket. It really is something that we look at that we can scale across our organization that's taking care of almost 13 million people.
It's a lot of people.
A lot of people.
All right, well, I see the flashing red light telling me we're over time. So thanks, everyone. I hope you will go out and disrupt something, innovate, and make sure it's good for patients, too.
Right on. Thank you.
Thanks.